At some point in your life, most of you guys probably heard something about the opioid epidemic. You may not know exactly what it is, but you probably heard of terms such as fentanyl, addiction, overdose, opioids. Does it ring a bell? If it does, good for you. If not, it's also totally fine because I have simplified everything you need to know about opioids in my research paper. So my research paper, if I give you like a general breakdown about what it is, it talks about the opioid epidemic, how it started, why is it relevant to modern society, and then I talk about more in depth about the different types of opioids that exist, how they affect the brain, and how it diminishes the perception of pain in our body. And then I also talk about the statistics on opioid use and overdose, and the history behind what led to the events right now, the addiction cycle, and how opioid use affects different populations. One of the key things I try to focus on was how it affects people with different mental conditions, whether it's depression, ADHD, panic disorder, and if it also has age differences or sex differences. And then in the end, I talk about why we should be talking about this, why it's very relevant. So that's the breakdown of my research paper. But today I'm just going to give you a basic rundown about what exactly are opioids. So opium is an extract from the seed capsules of the opium poppy, Papaver somniferum. Following the first isolation of morphine from opium, opioids and their active components have been researched and used in clinical settings. There are three main classifications of opioids. There are opiates, there are semi-synthetic, and lastly, there are synthetic compounds. Opiates are natural alkaloids, such as morphine, codeine, and papaverine. Semi-synthetic opioids are created in laboratories from natural opiates. They include diamorphine or oxycodone, if you guys ever heard of them. And lastly, fully synthetic compounds are produced in laboratories, but they're devoid of natural opioids. And the most famous synthetic compound is probably fentanyl, and they're known to be 50 to 100 times more potent than morphine. So the question is, why do people take opioids? The answer is actually really simple. It's because they diminish the perception of pain. So if this miraculously effective drug is so effective and good, what is the problem? Well, the problem is it's very, very addictive. In 2020, there are more than 68,000 cases of opioid overdose deaths, which account for about 75% of all drug overdose casualties that happened during that year. And it is also reported that between 1999 and 2016, the rate of death involving synthetic opioids, such as fentanyl, has increased almost 20 times. So now that we know the problem and the severity of the problem, you may be wondering, what have we been doing this entire time, right? So to give you a brief rundown, in the 1800s, clinicians considered pain as an existential phenomenon and prescribed cocaine and opioids to patients without any regulations. And in the early 1900s, the perception of opioids began to change as people started to understand the different side effects and dangers of opium addiction. So there were regulations that happened. And then it was all pretty okay until about 1995, when the American Pain Society's campaign to recognize pain as the fifth vital sign sparked a foundation of change towards the perspective of pain. Now, this, along with other efforts from the Joint Commission or the DEA, liberalized opiate prescription, and that's what led to the condition, the epidemic we are in today. So most importantly, now that we kind of got an understanding about the topic, how does it personally relate to you guys or every one of us? There are actually a lot of reasons why opioid epidemic is very relevant to our society right now, because by being aware of this national health crisis, you can better understand the scope of the problem and take steps to protect yourself and your loved ones. And probably this is the biggest misconception people have. opioid overdose can happen to literally everyone, anyone. Many people assume that opioid addiction only happens to those who misuse prescription opioids or use illegal opioids, but addiction can happen to anyone who's exposed to opioids, and even those who take them as prescribed by their doctors. And because the prescription is so liberalized, you may not know that you even have a tolerance that is built up towards these drugs. And by being aware of the risk associated with these opioids, people can take and make informed decisions about their health. And lastly, why it might be relevant to society and other people. There's a negative stigma surrounding addiction that can prevent people from seeking help. There's often a stigma attached to addiction, which can prevent people from seeking the help they need. And by raising awareness of the opioid epidemic, people can help reduce the stigma surrounding addiction and encourage those that are struggling with addiction to seek help. And lastly, the most important part is probably prevention. The opioid epidemic can be prevented through education, early interventions, and the appropriate use of prescription opioids. Even by being just generally aware of what's going on, you can even ask your doctor, oh, this is medication I'm taking for pain relief have some kind of side benefits or risks that I need to be aware of, or what are the active components within the medicine. And just by being aware of the opioid epidemic that exists, people can take steps to prevent opioid misuse and addiction and help ensure that opioids are used safely and effectively. So at the end of the day, it just comes down to regular people like me and you. Little, just like recycling has an effect on climate change and greenhouse emissions. Small steps and awareness from very commoners and students, and maybe future healthcare professionals like me and you, to really help direct the future of the crisis. Yeah, thank you.
Thanks so much, Ian. That was great. I have a few questions for you. I know you mentioned awareness is very important with the opioid epidemic, but would you say that there are any policy measures that also should be taken to maybe spread awareness or to handle or manage it in any way?
Yeah, actually, policymaking is probably the best way to control liberalizing prescription practices, and it has, after the major boom of narcotics, there has been more policy, there has been more regulation that has been taken in place. But at the same time, it's not that hard to acquire these narcotics in the first place. So it's a matter of there's a limit to how much policymaking can do. That's more of a top-down process, but looking from a bottom-up process, it's ultimately the people that are using opioids that are affected. So it's more important for the people to understand the side effects, the dangers, and the consequences of using, whether it's prescription opioids, illegal opioids. So awareness is also another huge factor besides policymaking.
Gotcha. Is there anything unexpected that you learned while doing this research?
Honestly, it's just there are lots of other drugs that we know of, but I never knew it was opioid related deaths were this predominant in drug overdose deaths, and also how easy it is to make compounds such as fentanyl. It's very, very cheap, but it's also 50 to 100 times more potent. And the fact that these really, really consequential compounds are being easily accessible in modern society is a big shocking point for me.
Gotcha. And are use cases for synthetic opioids different than natural opioids?
Well, so you're asking if synthetic opioids are different in chemically different than natural opioids,
No,
or
are they is the use cases are they used for different things, I guess?
I guess prescription opioids don't really contain synthetic compounds.
Gotcha.
For pain relief and medication. But at least in the illegal black market, a lot of the drugs that are not synthetic that are not said to be synthetic are synthetic.
Gotcha.
So it can be a lot more dangerous than you think it is.
Gotcha. Well, thank you so much for sharing all this. Hopefully this symposium in itself will spread awareness. And yeah, thanks so much, Ian.
Thank you.